Hey, it's Anna Zapp. February is Heart Month, and it's not anything to mess around with. And that's why joining us in the studio this morning, we have Dr. Lisa Freed. She's Director of Women's Heart and Vascular Program, Yale New Haven Hospital Heart and Vascular Center. And she's also Assistant Clinical Professor at Yale School of Medicine, so she's as legit as they possibly come. So, Dr. Freed, a couple questions I just wanted to ask you. How common is heart disease in women? I feel like you always hear about it in men, but obviously we are at risk too.
Actually, heart disease is the #1 killer of American women. It affects, actually it causes 1 out of every 3 deaths in American women per year, and that averages, it averages out to 1 woman dies every 80 seconds from heart disease.
All right, so what can women do to help keep their heart healthy? I mean, I don't know. Like, besides eating healthy, like what else is there to do?
That's certainly one of the things. Probably the most important thing is actually to be aware of this problem, because once you're aware of it, then you can start taking measures to make things better. And in terms of preventing your risk by controlling your risk factors. And have you ever heard of the Know Your Numbers campaign?
No.
So the American Heart Association has identified 4 different numbers that all women should be aware of in order to prevent heart disease. They need to look at their blood pressure, so to control hypertension. An ideal for that is less than 120 over 80. They need to look at their blood sugar or their blood glucose. Ideal for that is less than 100. They should be aware of their lipid panel or their cholesterol, so not just their total number, but their LDL, which is the bad cholesterol, their HDL, which is the good one. HDL for women should be greater than 50. Their triglycerides, which are the fat breakdown products, they're supposed to be less than 150. And in addition to all of that, the blood pressure, the glucose, the lipids, they also should be aware of their BMI, which is the body mass index.
Right.
And that's basically a ratio of your weight and your height, and the ideal number for women is less than 25.
Oh gosh, whenever I see that number, I'm never happy with it. That I know for sure. That's the one that always gets me every time. The way that men react to heart disease and women, is it the same or is it different?
There are a lot of really important differences. One is that when we talk about symptoms of heart attack, every woman should know that the #1 symptom of a heart attack for them is still chest pain. You hear of that elephant sitting on your chest, so chest tightness or chest pressure. That's the #1 symptom for men and women. There are also something called atypical symptoms, which I think a lot of people are aware of now. Women get atypical symptoms more commonly than men, so they might just get left jaw pain or arm pain alone or back pain. They might feel short of breath without any pain. Nausea and lightheadedness are pretty common as well.
And what are conditions that most women see when they're having heart issues?
The most common are heart attacks, or coronary artery disease. The other things that are more common in women is something called microvascular disease, where the big arteries are open, but the smaller vessels in the heart have blockage in them. And it can give them similar symptoms, chest discomfort, as the regular arteries having blockages. And also something called broken heart syndrome is more common in women. Say a stressful event happens and you get this rush of adrenaline, and it actually affects the function of your heart, and it can present just like a heart attack.
Right, it's a lot of scary stuff out there. So it's Heart Month. Don't forget to get yourself checked out. And thank you so much, Dr. Lisa Freed, for coming in today.